Hello everyone and welcome to my video on the topic of the effect of swimming on asthmatic children aged 14 years and under. Now the reason I've chosen this topic area is because in winter this is a common problem with a lot of children and I just wanted to talk about the benefits of swimming. For those of you who don't know, I'm also an accredited Ausswim swimming instructor as well as an exercise physiologist. And some of you may recognize me from Splash Swim School in Warriewood. I used to teach there when I was still studying, and sometimes I still make some guest appearances. So hi kids, hope you're all still having a lot of fun and enjoying swimming, and I hope you stick with it. Another reason why I've chosen this topic area is I used to be a competitive swimmer, and when I was in my masters we had to do a systematic review, and me and my friend Samantha Dixon decided to do this review on this particular topic. So I've done a lot of research on it and I will attach our unpublished systematic review on this attached to this video, and I hope you enjoy it and I hope you find it informative. So basically what I want to talk about is asthma and how swimming can help, and talk about the physiology as well. So asthma is a disease of the respiratory system which involves chronic inflammation within the lungs, and it is hyperactive in relation to the bronchi. Okay, so this can be controlled by medication, and what we want to try and do is talk about how swimming can help control this as well. Okay, so when we were doing the study, we talked about a few different things. So the different measures that we looked at were we looked at the respiratory function, cardiorespiratory fitness, how the lungs function. We looked at different questionnaires in relation to quality of life and confidence within the kids. And basically what this involved was, as part of the systematic review, we reviewed many randomized controlled trials and quasi-randomized controlled trials, and we put together the high quality studies and we summarized what they were talking about and what they found, and we came up with the conclusion. So a few different things in relation to the study. Most of the studies included only ones on sessions that lasted between 30 to 90 minutes, and usually they were between 2 or 6 times per week, and the studies lasted between 6 and 12 weeks. Okay, so what we found is that there was an improvement within lung function, there was an improvement within cardiorespiratory fitness, and there also was improvements in quality of life and confidence within the kids. And so that's really important, especially for asthmatic children, because a lot of kids don't want to participate in certain activities because they just don't have the confidence. And what we found from those results then, there were a few different reasons which they hypothesized why this is happening through physiology. So a few different things. They hypothesized that because of the horizontal position of the body when you're swimming, and also the rhythmic breathing, so there's a lot of breath control going on. For example, you take a breath to the side and then you're doing slow release of air under the water, so it's really slow bubbles, and then you're breathing to the side again. So there's a lot of breath control involved, which is what's happening inside the body, and so that's then relates to the physiology improvements as well. And what they found was that through doing this consistently over a period of time, that this improved the central blood flow as well as the ventilation rates. It improved the bronchodilation as well as blood flow within the bronchi, and it also improved in relation to the respiratory system. So you might find that a lot of the kids find, humid climate's a lot better. It's because basically what happens is there's less respiratory stress placed on the lungs because of the humid environment. And that's when they take their breath to the side, the most warm and humid part is just above the water level there. So where they're taking the breath, it's making it a lot easier for them to breathe. And another conclusion that we found from this study, and looking at various different conclusions, was that the main thing is it reduced hospitalizations, it reduced wheezing episodes, it helped control their symptoms. It also showed that it improved use, like decreasing use of medications, which is always good because kids don't necessarily want to be relying on it too much, but they know they have to have it with them, and it also decreased school absenteeism as well. So basically, kids are a lot happier, they're having a lot more fun, and they're feeling more confident because of swimming. I hope you enjoyed my little talk on swimming and asthma, and I hope you have a good look at my studies that I attached to this video, and I'll see you around. Stay tuned.